Hi, and welcome back to our podcast, Everything Hormones. I have a very special guest on with me today, and I always start with a prayer, so this prayer is for him. Dear God, thank you for the gift of a devoted teacher who faithfully studied, understood, and shared the research on hormone replacement therapy. Thank you for the countless hours he poured into learning, discerning truth, and presenting it in a way that brought clarity and confidence to so many of us. Through his diligence and obedience to the truth, the foundation of bioidentical hormone replacement therapy was strengthened, and countless lives have been blessed. Amen. Thank you, Dr. Neal Rouzier, for being here with us today, my 3-decade teacher. I'm so grateful.
Well, I'm in tears. Thank you for that, Dr. Ramsey. I'm going to call you Theresa. You can call me Neal. This
Yes.
is informal. We know each other too well to call us by
Mhm.
our formal names.
Yes.
That was so very sweet. And I thank you for that. But I'm only doing this because I only do it for the people that I know, love, and that are really, really good. And so I do tell this story at the conferences where this attendee went to all of the other anti-aging AFRM conferences and became more and more confused with what she heard and what she learned. And then she finally came to our conferences, then said, I forgot everything. I had to wipe out of my mind everything that I learned before because it didn't make any sense.
Absolutely.
Finally, it made sense. And then finally I started to implement it. And when I implemented what he was telling us and teaching us to do, it worked. And you've never looked back. And what now, 10, 15, I don't know how many years now you've been coming to the conferences and that you've been practicing this, and it works. So
Yes.
you are one of the experts. You're one of the people that was able to, um, shall we say, grasp this,
Mhm.
digest it, implement it, practice it, promote it, and look at the tremendous success you have in your practice and the tremendous success that your patients have benefited from all
Because of
because
you.
of that.
Yes. Yeah.
So, yeah, I taught you, but you were the one that took the baton and ran with it and
Mhm.
implemented it. And you're the one that sits in the room on a day-to-day basis to treat your patients.
Mhm.
And as a result, you're the successful one, and I congratulate you on that.
Oh, Dr. Neal.
That's my prayer. That's my prayer to you. Prayer
Thank
to
you.
God about you. Yes. So thank you so
Amen.
very much.
Thank you. I remember the very first time I was with you, there were probably 12 people in the room. Now there's hundreds of thousands depending on which course.
Oh, that was a long time ago. Are you
But
that old?
yeah, I was like, "What is he talking about?" And I really had to think. I mean, I never had to think before, but and then when I applied it and it worked, I'm like, I've gotta know more from him." So, I never left your side. I get all of my CEUs from you. Thank you.
You're very welcome. It's a
Yeah.
pleasure to see you each time.
Yeah, and the way you deliver your message is in a way that makes you think so that when you go home, you have the confidence to do this. So that's what I love.
Well, good. Yeah, it sometimes it's painful. It's sort of, it's very intense. It's sort of
Yeah,
like medical
very.
school teaching, training, lectures. And it's like drinking from a fire hose. People, as you well know, have to go back and take, part 1, 2, 3, and 4, the courses that we teach, multiple times. And the first time you go through, you're sort of blown away by it. You
Mhm.
understand it, but how to implement it, how to practice it, how to digest it and explain it.
Yep,
And you're an expert in explaining it. It takes time and patience, and sometimes that takes 2, 3, 4, or 5 times in order to go through it. But once you get it, once you grasp it, then you'll be the expert like you are.
mhm. I still pick up pearls, I'll go, and I'll still come home with a new pearl, like, it's unbelievable.
Oh, well, good.
Yeah.
Like one of our attendees, Dr. Morris from Texas, probably has attended, he says, like 20 times. And he
Mhm.
says, each and every time I go to the conferences, and I do change them, he learns new pearls, learns new things, and says, wow, I've heard that before, but it didn't sink in. Now I understand it. Now it sank in. And
Mhm.
I didn't realize it or understand it before, but now I do. It
Right.
takes multiple times to hear it in order to be able to process it and then implement it.
Mhm. It does, but then when you get the confidence, I always say to my patients that my practice mimics the literature.
Oh, well, good.
It really does.
Excellent,
Yeah,
excellent.
yeah.
Yes, and of course, unfortunately, we have patients that come to us and say, "I heard, I read, I saw,"
Mhm.
and they sort of just want confirmation. And you say, well, yes, you can do it that way, but it
Yeah.
doesn't work. Yes, but they say, I know, okay, well, if you want to do it that way and you think that it works because that's what you read, and what you read must be gospel truth, right?
Right.
Well, then go ahead and go somewhere else and do it that way. And then when you
Mhm.
they'll will come back and then they'll say, how did you know this? How did you learn this? How was it that you understood it, but nobody else did? Well, it's a painful process of learning, but you've been successful at it, whereas others have not.
What you do so well is you present the good studies and you present the bad studies and why they're bad, whatever that might be. There's a lot of reasons, but I love how it just goes back and forth, the course.
Well, I have to try to give the bad with the good and the good
Yeah.
with the bad. And in
Mhm.
order to understand why the studies are good, I try to explain that and why the studies are bad. And we shouldn't do that. We shouldn't follow that. And that requires tremendous insight in the literature, critical thinking, and understanding as to why we should not go down that path, even though that study shows that there's a problem with that. Why we should go down this path, because it's pretty much, and it makes sense, it's pretty much what works. But there's a
Mm.
lot of people out there, doctors, patients, et cetera, that do not understand the complexity of it. They think that everything that's negative refers to all of the hormones. And no, it's just the
Right.
synthetic Prem-Pro hormones, not
That's right.
bioidentical estradiol progesterone. And of course,
Mhm.
medical doctors and the medical societies don't like quote bioidentical or natural, but now we're starting to see them implement all of these um, conventional, commercial available bioidentical hormones into their practice and into their studies.
Right, right,
So what we've been saying for 20 years has finally been, vindicated. And yes, this is what
right.
we should be doing. Don't use the commercial available pharmaceutical
Mhm.
synthetic hormones. Use this. It
Yep,
makes perfect sense and it works.
yep, exactly. Yeah, so what I'm gonna do is I have a lot of questions for you, and
Go
they're
ahead.
questions that we both know the answer to, but I want my audience to hear it from you,
Sure.
so they're basic. Well, the first one is interesting. I haven't talked to you about this yet, but what do you feel about the FDA's decision to drop the black box warning on estrogen replacement therapy, increasing the risk of breast cancer?
I would like to answer that question in its entirety. It would take me 3 or 4 hours to answer it. Do I think about it? I think it's great. But on the other hand, I don't think it's that great
Uh-huh.
because um, there's a multitude of studies, and the literature shows that if you use a synthetic progestin like Provera, which was used in the WHI, it can increase your risk of breast cancer. In addition, the WHI showed that there was an increased risk for blood clots and strokes with synthetic hormones. We do not see that with the bioidentical estradiol progesterone, but they're commonly all lumped together. And as a result, the FDA and the medical societies lump all of the hormones together.
Mhm.
That it doesn't matter if it's bioidentical or natural or not, there's still risk to it. Well, no, there's not.
Done
So
right.
the administration finally coming forward and saying, "Oh, wait a minute, what you've been saying is incorrect." And it is true, it has been incorrect,
Mhm.
but nobody can go in there and change it. Well, the administration has now said, nope, we should not put this label that goes in the PDR that these hormones are harmful. So if you read the PDR now, it does away with all of those
Mm.
harmful restrictions in lieu of the fact that there's a lot of good evidence. All of the evidence shows that the bioidentical estradiol, progesterone, and testosterone are safe. They're not harmful. Don't lump them in the same category as Prem Pro. So it's a very good step in the right direction.
Mm. I agree. My concern was the prescribing is going to be wrong. Like my biggest concern, because I've seen it in my practice when patients come from other doctors, women with uterine cancer, because they were on 100 milligrams of progesterone. Like my biggest concern is, physicians doing it right.
Oh, welcome to my world.
I know.
What I see done, what I see practiced, is appalling.
Hmm.
They don't understand optimization. They don't understand you need to use a certain dose and achieve a certain level in order to be able to become efficacious.
Hmm.
And a
Right.
lot of these doctors, on the other hand, what you didn't address was, okay, well, if all the hormones are good, then let's prescribe Prem Pro.
Yep.
No,
Yeah.
that's really not what was intended. What was
Mhm,
intended was that, yes, Prem Pro are problematic, not as harmful as perhaps what we once thought, but still they're problematic. I
mhm,
would not prescribe those hormones, and I think that's really what the message should have been. The bioidentical, whatever term you want to use, um, and there's a multitude of different terms used. Just replace what was lost. Replace estradiol. That's what was
right,
lost. Replace
right.
progesterone. That's what was lost. Don't replace something that's chemically altered or different that has been shown to cause breast cancer in multitudes of studies.
Mhm,
And
mhm.
all the meta-analysis show there's an increased risk for breast cancer with the progestins. Why do they still continue to manufacture them and produce them, and why do doctors continue to prescribe it?
I was
It's
gonna say that. Prempro should not be
ludicrous.
on the market.
It should not be, but it is because of politics and economics.
Mhm,
There's no other way to explain it, which is why my disdain for the medical societies that still say, well,
mhm.
there's not enough data, there's not enough information. Yes, there's plenty of data, there's plenty of information. You have a confirmation bias against it because you can't market against it because you get all your funding from big pharma.
Yep.
And when you start to denigrate it, like all the studies show it's harmful, then you lose that funding. You lose the funding from the drug industry
Yeah.
that promotes your medical societies. And so not everyone understands the politics and economics behind
Mhm,
that.
mhm.
So this
Yeah, I
current recommendation from the uh, current administration is a very good step in the right direction. I wish they would have gone further and said, well, there's still some problems with the synthetics, but we don't see those problems with the bioidenticals. That's what I wish that they would have said. Instead, they said just a blanket, we're going to take away um, the harm and we're going
Mhm.
to take away um, the advertisement in the PDR that all hormones are harmful. What they should have said was, yeah, those are probably still a little bit harmful,
Mhm.
but these other ones are not harmful. I wish that's what the direction would have been that they would have taken, but they didn't.
Well,
It's a
maybe they'll
step in the
refine
right,
it over time, right?
it's a
Maybe they'll refine it.
step in the right direction. It's
Right,
okay.
right. I agree, I agree. I sent Dr. McCary my book just to say, "This is my concern about this, but I'm grateful, that at least the fear is being dropped."
Yes, exactly.
Yeah. So this is about the same topic. Why do you think oncologists continually tell women with estrogen-positive breast cancer that estrogen caused it?
I have to break that down into a couple different answers. Um, well, probably because they're not trained, but
True.
um, it's probably more of, um, and that statement is entirely wrong, of course.
Mhm,
Estrogen does not cause cancer. And of course, even the most recent administration says it, and all of the medical studies and the literature and our medical societies now say, stated, estrogen doesn't cause cancer.
mhm.
Taking estrogen does not cause cancer. In the WHI trial, it showed that, which is the most powerful study
Right.
to date on estrogen, showed that estrogen does not cause cancer. And the only drug in the world that actually decreases the risk of cancer is estrogen. But the oncologists, because of their training and
Mhm,
because they use estrogen blockers to treat estrogen cancer,
mhm.
will confabulate that estrogen caused the cancer. So, no, it doesn't cause it. All the studies show that it doesn't. If you say that it caused it, you're entirely wrong. Here,
Right.
read this.
Mhm.
That's an absolute lie and
Right.
incorrect.
Yeah.
Why do the oncologists say it? They're not trained. They're not hormone doctors. Oncologists are cancer doctors. They are not hormone doctors.
Mhm.
They think
Exactly.
they're hormone doctors. They're not hormone doctors. They're cancer doctors.
Right.
They should get out of the hormone
Mentioning hormones.
arena because everything that they say, unfortunately, is incorrect and
Mhm.
wrong. But
Yeah.
that's just the system.
And they
It is
scare
the system.
patients, and they make them think they caused it and all of that.
Exactly.
Yeah.
Well, let me take that a step further then.
Mhm.
So, estrogen doesn't cause cancer, but if you develop cancer, the oncologist will use estrogen blockers. I was at a meeting recently where an oncologist spoke up and said, no breast cancer survivor should ever, ever, ever again take estrogen. And I said, okay, here, read JAMA. JAMA says, and of course, I'm always coming prepared to these meetings. I'm going to read right out of JAMA, our most peer reviewed medical journal.
Mhm.
Estrogen doesn't cause cancer. In fact, estrogen has been shown to decrease the risk and incidence of cancer.
Mhm.
The only drug in the world that has been shown to decrease breast cancer mortality are not estrogen blockers, it's estrogen. And when you say
Yeah.
no woman should take estrogen that has an estrogen positive tumor, that is against the medical literature, but that's the way
Mhm.
they are taught and trained because the drug industry forces them to use the estrogen blockers.
Mhm.
But
Yep.
as you well know, long term, the estrogen blockers actually increase the recurrence of,
Mhm.
estrogen positive cancers. So we're giving something to stop the recurrence for 5 years. But after 5 years, if you continue to take those drugs, it increases the risk of recurrence.
Yeah.
So, how is it then?
Right.
The oncologists don't know, they don't know OBGYN hormone literature, but
Mhm.
they're not hormone doctors. They're not
Mhm.
taught or trained. So, why do the oncologists say that? They're not taught and trained correctly. They're not hormone
Exactly.
doctors. They don't attend hormone lectures. All they do is know that this drug is used by the drug companies to treat an estrogen positive cancer. For 5 years, it works. After 5 years, it stops working and actually increases the risk of recurrence. Well, then what drug can we use to decrease the risk of recurrence? And at the last annual summit, I showed you all those studies where estradiol is now used in patients with breast cancer recurrence to
Mhm.
treat the breast cancer recurrence to decrease metastatic disease.
Yep.
Estrogen
Yep.
is used to treat the metastatic disease that the drugs didn't prevent. So anyway, they don't know it. Don't
Yeah.
expect them to know it. Don't argue with them, and it's best just to walk away.
Worse yet, they tell estrogen negative breast cancers not to take estrogen.
Oh, of course,
It just
estrogen is verboten
yeah.
by any oncologist.
Mhm.
Oh, and when the patient comes and says, "Well, I want to discuss it with my oncologist," fine, go ahead.
Mhm.
Please go see somebody else. I'm not going to play this tit for tat with the oncologist. I'm not going to be pitted against your oncologist.
Right.
If you don't
Right.
want to take hormones, that's fine. Yeah, but they scared me. They told me, then don't take them. It's fine.
Right. You can't
But
there's
I'm
nothing you can
miserable.
do. Right.
I'm miserable.
Right.
And all this literature says I'm going to die sooner if I take those drugs. You're right. You are going to. Well, then what do I tell them? What do I do? You don't tell them. You can't discuss it. You can ride one horse,
Mhm.
this horse or that horse. If you want to ride their horse, be my guest. Here, read this and what happens when you ride their horse. Here, read this, what happens when you ride our horse. You're
Mhm.
going to be miserable from estrogen blockade, and you're going to die from either breast cancer or some other cardiovascular disease because you block the estrogen.
And suffering.
This study here, we're giving estrogen to estrogen positive tumors that have a recurrence because they failed those drugs, and we're now giving them estrogen.
Mhm.
And estrogen controls their disease, it controls their spread of the cancer, and it protects them from getting the heart disease that kills most women.
Yes.
And that's what happens when they take the estrogen blockers. There's an increase in cardiovascular disease and mortality from
Mhm.
taking the estrogen blockers. When you take the estrogen, there's a decrease in cardiovascular disease. When you
Mhm.
take the estrogen and a decrease in the metastatic disease. Which one would you like to take? Here, read this. You decide. Well, my doctor scared me. Then you do what your doctor says.
And they make a fear-based decision.
Yep, go
Yep.
right ahead. We
Right.
understand.
Right.
Why did you come to see me in the first place? Because you're the hormone expert. Okay, but you don't want to listen to me. Well, my doctor scared me. Well, then you do what your doctor says.
Mhm.
Those patients that come in and say, I read it, I know it, I understand it, I've got a good handle on it. Will you prescribe it? Yes. Now we need to discuss it. Here, you need to read these studies, sign this
Mhm.
consent. Thank God they did, they say, because
Indeed.
they feel so much better. And now all the literature shows protection against recurrence. Anyway, I've taken this down the rabbit hole too far. Go
Mm.
ahead.
No, I love it. Well,
You
on that
asked.
note yesterday I had a patient come in and she's on hormones with me feeling great. She goes, "My gynecologist told me how risky progesterone is." I
Oh,
said,
yeah, sure.
"Progesterone?"
Yeah.
She goes, "Yeah, my friends tell me, I don't know." So, what
Here,
would you
read
say?
this. Read this. They're calling progesterone
Proge
harmful because they think that it's a progestin like Provera, because
exactly what I told her.
doctors misconstrue the terminology. They say progesterone. What they meant was progestin. Yes, progestin is a hormone. We agree with your doctor. Don't take progestins. It's harmful. But don't extrapolate that a progestin is progesterone. They're not the same. They're apples and oranges. They are completely different. And it's
Mhm.
amazing that the gynecologists don't know the difference.
Where
It's
women go
just
for help.
amazing.
Yeah.
But, of
Yeah.
course, all the gynecologists that attend the conferences go, "But that's what we are taught." We're not taught anything about hormones in the residencies. They're not taught anything about hormones
It's a crime.
Bioidentical societies. It's just
Mhm.
criminal. It's just criminal.
Yeah, absolutely. Same with men. Urologists here still are telling men, do not touch testosterone. It will cause prostate cancer.
Yeah, here, read this.
Mhm.
20 years of studies showing that it doesn't. In fact, there's 20 years of studies showing that it actually protects against
Right,
prostate
right.
cancer for a multitude of different reasons. Here, read this, what my doctor says. Do you do what your doctor says? How's that working out for you? I feel like crap. Well, you look like crap too. Okay. How is that working out for you? But my doctor said, you ride your doctor's horse. That's fine.
Mhm.
Don't come back
So
and say my
sad, Neal.
doctor
It's
says.
so sad, yeah.
When you come back and say my doctor says, here, read this. Did you read this? Yes, I know, but my doctor said.
Mhm,
That's what I expect your doctor to say. Sorry, you do what your doctor says.
mhm.
But I feel lousy. You ask you what your doctor says to do. He says I got to eat right and exercise more, but I can't. I understand that. Well, what do
They
I do?
even say that?
You do what your doctor says. Don't come back
Mhm.
and say my doctor says. We're done. We're
Right,
absolutely done.
right,
Your
right.
doctor's not a hormone doctor. They don't understand.
Yeah, I never understood as I was studying with you, if all these studies are here, why doesn't the FDA know about them? Like, and now why don't gynecologists? Why don't urologists? Why don't cardiologists understand?
The doctors, yeah, if a doctor's not up on it, they're down on it. And
Yeah.
these doctors are not up on it, so they're going to be down on it. And that's just
Mhm.
their knee jerk reaction.
I
And
yeah.
it's difficult to explain that they're not hormone doctors. It's difficult to explain, they fear hormones. They fear anything. And as a
Mhm,
result, they're going to say blanket, no hormones. Well, this is what happens when you don't optimize your hormones.
mhm.
Here,
Right,
read this.
right.
Why doesn't my doctor know this? Because he's not educated. He's not trained in hormones.
Mhm.
That's why. Oh, can you call him and talk to him? Nope, can't call him and talk to him. Sorry.
Tried that, doesn't work.
Here, you got
Yeah.
two horses. Which one do you want to ride?
Mhm. Exactly. And then in December, the FDA lifted the warning on testosterone,
Yes.
increasing heart disease because of the Traverse study.
Yep. Yeah, sure. No, it's causes heart attacks and blood clots. Here, read this. No, it doesn't. But my doctor said, okay, you do what your doctor says. Your doctor doesn't know the most current, recent literature.
Mhm,
You can read it for yourself if you like. It's right here.
mhm.
How come my
February of
doctor doesn't
25.
know this? You ask him that
Mhm.
because he's not a hormone doctor. He's not trained. He doesn't know any of this. But he's certainly given his opinion, which is going to be if a doctor's not up on it, they're down on it. They're
Right.
not up on it, so they are going to be down on it. And it's just the nature of the beast.
I wonder if cardiologists are giving a rebuttal to the FDA for that, because they really believe it.
Yeah, I know. It's
Mhm,
difficult to change habits.
mhm.
It's really difficult to tell them that what they've been believing, saying, and preaching for years was wrong and incorrect. And that they just can't handle that,
I know.
which is too bad.
It's sad for their patients, but at
Yeah,
least you've
well,
trained enough of us
yeah,
to be
it's
patting our horns.
for those of us that understand it, know it, teach it, and preach it, and prescribe it, and see the tremendous benefit to the patients,
Mhm,
give them the literature, the studies to read if they're interested in it.
mhm,
It's confusing why their doctors don't understand this and promote it. This is the medical literature. It's evidence-based literature. It's
mhm.
current science.
Yep,
Doctors preaching what you learned 20, 25 years ago, which was incorrect.
very true. I have just a few more questions for you.
Okay.
Um, what do you think the best way is to prevent Alzheimer's?
Teresa, you're asking me questions that take 3 to 4 hours to answer.
I know that's hard for you.
So, what is Alzheimer's disease? Alzheimer's disease can be genetic and it can be environmental. It can be also due to multiple different pollutants like heavy metals in the environment. And it can be, of course, multifactorial. So, am I worried about Alzheimer's disease? No. Why? Well, because I take everything to prevent it.
Mhm.
um, there's two drugs, medicines, and I hope that your audience understands the sarcasm in that. There's two drugs, medicines that I take to prevent Alzheimer's disease. One of them is testosterone, the other one is estradiol.
Right.
Both of those medications, which I call drugs,
Mhm.
which was tongue in cheek, they're
Mhm.
not drugs, they're hormones. Drugs don't work, sorry.
Right.
And I'll explain that in a second. All of the studies show that when these medications, hormones, are administered to both males and females, there's a dramatic reduction in plaque in the brain. Plaque meaning beta amyloid protein plaque, which is the plaque deposited on neurons in patients that have Alzheimer's disease. That plaque can be reversed and diminished. Well, if you can reverse the plaque, then why should we not prevent it in the first place?
Right.
Well, that's exactly right.
Mhm.
That's why we take the hormones to prevent the beta amyloid plaque from being deposited on the neurons that's causing the Alzheimer's disease.
Mhm.
Studies show that we can reverse that. Studies show that we can prevent that too.
Mhm.
The drug industry has spent billions and billions of dollars to try to come up with some monoclonal antibody to remove the plaque off of the brain, off of the neurons.
It doesn't work.
I know that. That's the problem. The studies show that it does remove the plaque, but it does not
Okay.
improve the
Yeah.
disease
Yes.
process.
Yes.
It does not improve clinically the disease process. The disease process still continues to progress. So they've spent billions of dollars on all these monoclonal antibodies. Some of them removed the plaque, some of them didn't, but overall, almost all of them do not result in any benefit.
Clinical benefit, right.
And there's thousands and thousands of dollars being spent, which is why Medicare says, wait a minute,
Mhm.
we need to do these studies first before we're going to approve these. So most patients with a little bit of Alzheimer's disease are spending $30,000 a year on these monoclonal antibodies
Mm.
that have not been shown and proven to work,
Mhm.
or have been shown and proven to work a little tiny bit by slowing down the disease process, but not reversing it. So there's a multitude of different things that can factor into causing Alzheimer's disease. What studies do we have? What evidence based literature do we have to show that we can reverse that? There's quite a bit,
Mhm.
but they're not patented medications that the drug industry is going to make billions of dollars off of.
Mhm.
So they're going to spend all this money trying to come up with a monoclonal antibody, and they've tried it for 10 years. The first one that was FDA approved is now off the market because even though it got FDA approval because it got pushed through, it didn't work.
Right.
And the drug company said, well, if it didn't work, then everyone stopped prescribing it. We should take it off the market. It doesn't make sense to keep manufacturing it if it doesn't work. So they're
Mhm.
coming up with all these other monoclonal antibodies. And it's a perfect example of everyone quotes Einstein as saying that, but nobody knows who originally stated this. If you keep doing the same experiment over and over and over again, expecting different results, that's called stupidity.
Mhm.
So they're still making all these monoclonal antibodies to remove the plaque that is there,
Yeah.
and it doesn't work because the disease process has not been stopped. What they're doing is removing the plaque off of the neuron, but they're not stopping the disease process that's the damage inside the neuron that's
Right.
causing the disease.
Right.
That's what they don't see and understand. They think it's the beta amyloid plaque deposition. No, it's the hyperglycemia, the insulin resistance
Mm.
inside the neuron that's driving the disease.
Mm.
Testosterone and estradiol help reverse that.
And
It is
prevent.
really key. You can see that I predict that these new GLP-1 receptor agonists, the tirzepatide and semaglutide,
Mm.
are probably going to eventually be approved for preventing and treating Alzheimer's disease because it makes the insulin resistance inside the cell better.
Mhm.
And that's exactly what testosterone and estradiol do. And there's a
Right.
multitude of different enzymes that estradiol and testosterone produce that protect against the disease process inside the neuron.
Right.
No drug so far does that, but
Yeah,
the
they're focusing on the
GLP-1s are a
plaque.
step in the right direction,
Mhm.
but they don't increase the enzymes that are protective, and testosterone and estradiol do increase those enzymes. I presented that a couple of years ago at the annual summit. All the studies demonstrating reversal of plaque, but clinical improvement in double-blind studies with estradiol and
That's
testosterone.
right.
So
Mhm.
how do I treat it? How do I prevent it? Hormones. It's quite simple. And once you understand the MOA, which is the mechanism of action,
Mhm.
once you understand what is causing the disease process inside that cell,
Mm.
if you reverse that disease process inside the cell, you can protect against the disease from occurring.
Mhm.
So your original question was, can you protect against Alzheimer's disease? Yes. Can you reverse it? Yes, you can. And you can certainly slow it down. The monoclonal antibodies, nice try.
Mhm.
Everyone's grasping at straws. Anyway, I hope that answered
Nice
your
to see the
question.
research that's been done. Yes, it did very much so. Thank you. Um, What statin would you give a woman for primary prevention of heart disease?
You know, if do me a favor, stop asking questions, take 5 hours to answer. So,
You're welcome.
if it was me or mine,
Mhm.
what would I be doing? It's really simple. So, conventionally, all doctors, all cardiologists are going to prescribe a statin, a cholesterol-lowering medication. It is standard operating procedure. There's studies to show that it doesn't work. There's lots of studies to show that it does work, but minimally. Okay, great. Well, then take it. That's the only drug that the cardiologists have
Yeah. Mm.
to prevent the disease by lowering LDL cholesterol. And if the statin doesn't do it, then we add another drug onto it. If that doesn't do it, then we add another drug onto that are really expensive and cause significant side effects. But that's all they've got.
And that patient ends up on the OR table. Mhm,
Exactly.
mhm,
They will eventually end up on the OR table
mm.
for the bypass surgery.
Yep.
So how can we reverse the plaque? Well, the studies show that majority of the studies show that you're not going to reverse the plaque. The coronary calcification continues to progress with the statin medication. It may
Mhm.
decrease events, heart attacks, but it
Right.
doesn't slow down the plaque inside the blood vessel.
Mhm.
What does that? Well, in the last 2 webinars that I just gave for WorldLink, I explained what does that, and it's for women, it's estradiol.
Yeah.
It will reverse the plaque. It reverses all of the abnormal cholesterol and lipid parameters. Statins will lower the LDL cholesterol, which will result in a decrease in events, maybe 2 to 3% absolute risk reduction. 2 to
Mm.
3% means 2 to 3 out of 100.
Mhm, mhm.
Okay, well, what about the other 97%? Well, they will go on and have the disease. Well, how can we figure out which ones that should get it? Well, you have to treat the whole entire population. Well, when you do, there's an increased risk for diabetes and cancer.
Mm.
But they always say, but the benefits outweigh the risk. I don't believe that. Taking a drug that increases diabetes, Alzheimer's disease, dementia, and cancer does not seem like something that I want to do, but they have to do it. Do the doctors tell the patients the side effects and problems with it? No, they don't. You have to read the package handout in order to understand that. If the doctors told them that, if we told them that, the patients wouldn't take it. So, what then can we do? Well, every study, every outcome study in the literature shows that estradiol significantly decreases and reverses plaque. Estradiol decreases and reverses heart attacks and heart disease.
Mm.
The outcome studies are absolutely amazing. Then why doesn't the cardiovascular world embrace this? Not a patented drug. And of course, everyone knows in the WHI study, hormones were bad. So hormones are bad and therefore don't take hormones, including estradiol and progesterone. In every study, estradiol and progesterone have been shown to decrease plaque and to protect against heart disease. And there's a 50% decrease in heart disease with hormones. There's a 2 to 3% decrease in heart disease with the
That
statins.
yeah,
Everyone gets a statin, nobody gets the estradiol.
well said.
It's the system.
Mhm.
Can't fix the system, but I can show you the studies. These are the studies to show that the coronary artery calcification progresses with the statin, and there's a risk for diabetes and cancer as a result of it. Oh, but the benefits outweigh the risk. Uh, the risk is getting cancer and diabetes?
And
Yes.
Alzheimer's?
Okay, but
Yeah.
it's the risk that you should take. Why don't we use estradiol? There's a decrease in cancer, there's
Mhm.
a decrease in heart disease, there's a decrease in diabetes when estradiol is taken along with progesterone. No, you can't take hormones because hormones are bad. Where does it say that? In the PDR. Well, that's been removed,
Mhm.
thank goodness. No, they don't cause heart disease. Um, but it's hard for the average everyday patient to understand this because it's so complex. If the doctors don't understand it, if the cardiovascular academies don't understand it, then how is a patient supposed to understand it and navigate through it?
Exactly.
Patients don't want to take these drugs. There's side effects to them, problems, complications. They can't think correctly. They have muscle pain. There's a multitude of different problems associated with taking the medications. But unfortunately, the doctors don't have anything else, and so they prescribe them.
Mhm.
Well, patients come to us and say, we don't want to take these drugs. Well, then don't, but don't tell the doctor that I told you to stop it. I'm not stopping it.
Mhm.
Well, what would you do instead? Hormones. Look at these outcome studies.
Mhm.
50% reduction in cardiovascular disease versus a 2 to 3%. Which one would you like to take? I'll take the 50%. That's the estradiol. That's the estrogen.
Yep. Yeah.
So anyway, that's how
So
you
well said.
reverse Alzheimer's. That's how you reverse cardiovascular disease.
Mhm. Beautiful. Um, yeah, there's more questions, but what I wanna bring up is your book that you wrote, was it last year or the year before?
Yes,
Normal isn't optimal, conversations we have every single day with patients. Who wants to be normal anyway?
correct.
Yeah.
Exactly. It's a
Mhm.
difficult concept to understand
Mhm.
that normal is not optimal because the endocrine world will treat a deficiency and put the level up to normal. In our specialty, we don't wait for you to have a deficiency. If you have normal levels, you still benefit from the hormones by optimizing them.
Mm,
The more, the better. The higher the level of the hormone, the better the effect. It doesn't
I
plateau.
agree. Mhm.
And the endocrine world will say, well, no, you don't need to use hormones if the levels are normal. Yes, but normal is not optimal. That's the reason for the title of the book.
Mhm. Yeah, I read it, I loved it, and you put GLP-1s in there too, which I liked. Yeah.
Normal's not optimal. And of course, those are medications, which
Mhm.
I don't like talking about. But the intent was to show that these medicines, which decrease blood sugar, provide benefit and they provide weight loss. Well, hormones also provide weight
Yeah.
loss. The more you optimize them, the more weight that you will lose, and the better cardiovascular protection, cerebral vascular protection, dementia protection, diabetes protection you'll gain by optimizing your hormones.
Amen.
But it's a concept that they don't know or understand because they haven't taken the courses to understand the literature.
Mhm.
You
Right,
have.
right, right. I think that you need to be hired by the FDA.
Yeah. Yeah. Well,
Change all the standards for every specialty.
yeah, unfortunately, the FDA requires verbiage in the PDR that all hormones are the same. They do
Mhm.
not differentiate
Yeah.
between Premarin and estradiol. They don't differentiate between Provera and progesterone.
Mhm.
They're all the same. And that's where this communication breaks down, and doctors do not understand that there's a difference.
True.
There's a difference in hormones, and there's a difference in normal is not optimal.
Mhm. Absolutely. Then I wanted to ask you if you had a chance to read the book I sent you.
I did read it. Thank you. It was
Yeah.
a
You're wel
wonderful introduction for your patients and for everyone to get the concept as to why we do what we do.
Mhm. Exactly. Written at a 6th grade level, couldn't be easier to read.
Yes,
Mhm.
exactly.
Yeah.
So, it's not designed for a, um, research scientist to read. It's
Right.
designed for the average everyday person to read and understand, this is what we should be doing based on the literature and the science.
Mhm.
Here, read this. Here, do this. This is why we do what we do. This
Right.
is an introduction to hormones as to what you should be doing for your long-term health, but
Mm.
also your long-term wellness.
That's right. That's
A
right. Risk
concept that we
reduction.
doctors are not taught, and we don't promote it, which
Mhm.
is unfortunate.
Right, right, I know. So, my last question really is about, like, I've been studying with you through World Link Medical for all of these years, and, this is your last year teaching for them, I understand. Which
Yeah,
have you
that's very
invented?
unfortunate. We have parted ways, and the reason that we've parted ways, and it's a very unfortunate reason for it, um, as you have mentioned in this discussion, how complex the courses are.
No.
They are medical school type lectures. It is like drinking from a fire hose.
Yeah.
Not everyone can grasp it or understand it like you do. Most people do. Some do not. And as a result, the majority of, unfortunately, new nurse practitioners coming fresh out of school cannot handle the intensity or the complexity of the courses.
Mm,
They therefore have written um, complaints to WorldLink that they are not being educated like they had hoped. It is too much, too fast, too quick, too complex, too much in depth for them to understand it and grasp. So WorldLink came to me and said, you have to dumb down your courses so that the people that have relatively the inability to grasp very complex medical school type of lectures can understand it better. You have to dumb it down. I said, I can't dumb it down. I can't change what I've been doing and teaching for 25 years that has resulted in such benefit and success for so many practitioners.
Mm,
I can't do that. So WorldLink said, if you can't do that, you need to move on. So they politely invited me to leave
Neil.
because I didn't want to dumb it down. So now they have a new Optimal Health series that is a dumbed down version of my courses to
Mm.
make it very, very, very simple to understand so that people coming in with no medical knowledge or minimal medical knowledge can understand hormone replacement. But it's not going to enable them to be as well trained as you are and the other practitioners that have taken all the courses.
Have
There's
those
a
nurse
great
practitioners gone through all 4 courses? Made it to the end?
There are some people that just cannot understand it. It is too complex. It's too much for the little brains to handle.
Mm.
Their complaints were well received, and as a result, I was invited to leave.
Ugh.
So I'm no longer going to be, after this year, teaching the courses at WorldLink, which is unfortunate. I will still do the courses in Canada, and until I find a new platform, I will not be teaching the WorldLink courses anymore.
Is there a name of the Canadian platform?
It's called True Balance. True Balance is the Canadian version of WorldLink,
Okay.
and I will still be teaching all of the courses and trainings up there
Okay.
in
Well,
Toronto.
good. I'm grateful. For me, I'm selfish.
Now, I understand. So, yeah, the courses will be available February, March, April, and May of this year through WorldLink, and then after that, they've invited me to leave. And then they will continue to teach the Optimal Health series, which translates to a dumbed down version um, for everyone with simple minds to understand, but they will not grasp the complexity of the subject matter, which is very unfortunate.
Because it's such an important topic to know right, and the way you teach is fast and furious and with a hint of sarcasm in there. We have to you make us think, and that's what I loved about learning from you, is if
Well,
if
good.
I just got spoon-fed, I don't know that it would mean that much to me.
They want to be spoon fed. They're very simple. Just give us the protocols, tell us what we need to prescribe, and turn us loose. Okay,
Yeah.
we're done. I don't want any part of that.
Mhm.
So as a result, um, WorldLink has invited me to leave. I didn't quit. I didn't leave. They invited me to leave.
Mhm.
Oh, and I'm putting it very simplistically.
Yeah, well, I didn't know that. I'm grateful to know that you're still teaching, because I only get my CEUs from you. I refuse to
Well,
get them anywhere
thank
else.
you. Thank you. So,
Mhm.
it's just that I will not be doing it anymore for WorldLink, and they're going
Yes.
to continue the series, designed for nurse practitioners.
Mhm. I see.
Um, Not complex nurse practitioners,
Mhm.
like and naturopathic doctors and other physicians and doctors, that have enjoyed the trainings over the last 25 years. I will still continue to do that elsewhere,
Mhm.
but not with WorldLink. They're headed in a new direction, and unfortunately, then I must also.
Sure. Yeah, I understand. I
I'm
understand.
not going to stop teaching and educating.
Mhm. Good. Grateful.
Well,
Is there
good.
anything you wanna say that we didn't cover today?
I suppose I should give you a special thanks for being, as some people call me a pioneer in this.
Mhm.
And you have certainly been a pioneer for your patients.
Mm.
And I'm glad that you grasp it. I'm glad that you are able to write a book to try to educate your patients and educate the public as to what they should be doing for the long term health, wellness,
Mhm.
and to help improve quality of life.
Right.
Patients don't know and understand until they really feel better how important this is.
Yeah,
But
exactly.
it is an interesting concept of not only is it so very good for your health, It's also good for your wellness, but it's also good for how you feel and function on a day-to-day basis.
Mhm.
There's no drug, there's no medicine that does what these hormones do as
Right.
far as making you feel so much better
Mhm.
and function so much better and protect against the diseases that we discussed.
Mhm.
It's pretty much a
Absolutely.
no-brainer. And it's like it falls between the cracks. It
Right.
just falls between the cracks, which is a very fascinating uh,
Mhm.
lack of our system.
Yep, it's a system problem. Yeah. But I'll give you a testimonial. I'm 61 years old. I have no pain. I have no fatigue. I have no insomnia. I have no weight gain, right?
Yes,
Because of this. Because of this.
you walk the walk, you talk the talk, and of course, when your patients see you, talk with you, they say, "Okay, I wanna be like you.
I know.
Just tell me what you're doing, and I wanna do the same thing, alright?
Mhm.
This is what I do, and this is
Mhm.
what I do for you. Okay, let's do it.
Right,
Perfect."
right.
If you
Then you
don't
see
walk
me a
the
year
walk,
later. Yep.
yeah, you don't walk the walk, talk the talk, and
Mhm.
you don't look the role, I mean, you just glow with enthusiasm, and of
Mhm.
course, you glow with knowledge. So, my congratulations to you on that. So I hope that you could help so many more people in the future.
Neil, thank you.
You're
Thank you
welcome,
so much
Teresa.
for everything you've done for me.
Thank you, Teresa, and you're so very, very welcome. I hope this was of tremendous benefit for your patients
I
too.
know it is. I know it will be.
Good, excellent.
All right. Well, enjoy the rest of your day, Neil.
Thank you. You too. Bye-bye, Teresa.
Bye-bye.
Thank you.